Today I want to talk with you about congestive heart failure. I have a student who will be asking some questions similar to what you would ask. So let's begin.
What is congestive heart failure?
Before I start giving definitions, let us review the anatomy of the lungs and heart and the basic physiology of blood flow. In a normal, healthy person, blood returns to the right atrium from the superior and inferior vena cava. This is deoxygenated blood. It then flows through the tricuspid valve into the right ventricle. It flows from the right ventricle through the pulmonic valve into the pulmonary artery, where it is taken to the lungs to be oxygenated. After the blood is oxygenated, it flows into the pulmonary veins into the left atrium. From the left atrium, the blood flows through the mitral valve into the left ventricle. The blood then leaves the left ventricle through the aortic valve into the aorta. From the aorta, it supplies the brain and the body. Please keep in mind that blood always flows towards a lower pressure.
How many types of heart failure are there?
Well, we can classify heart failure as follows. Number one, there's right-sided versus left-sided heart failure. Number two, there is systolic versus diastolic heart failure. And number three, there's high output versus low output heart failure. Keep in mind that when we talk about congestive heart failure, it is the lungs that become congested due to failure of the heart to pump blood forward.
Can you talk about right-sided and left-sided heart failure? What do you see in each?
Let me start with left-sided heart failure. While there are many reasons, they all point to one end, and that is failure of the myocardium to pump efficiently. Ischemia is believed to be the most common cause. If the left heart fails, then blood will pool in the left ventricle and the pressure in the left ventricle will go up. This pooling of blood and elevated pressure will also be experienced by the left atrium. This means that the lungs will now have to push blood against a greater pressure, which will eventually lead to pulmonary congestion.
What are the signs and symptoms associated with left-sided heart failure?
As a general rule, left-sided heart failure has symptoms. These patients will have, number one, shortness of breath with exercise or in the supine position. Number two, they will wake up during the night with difficulty breathing. Number three, they may have persistent coughing or wheezing. Number four, they will complain of fatigue and weakness. Number five, they may report oliguria, which is a decreased urinary output.
What are some of the complications of left heart failure?
Well, it can result in number one, right heart failure. Also, there may be cardiogenic pulmonary edema. Number three, pulmonary hypertension. Number four, hypertension, and this might be triggered by the renin angiotensin system. And number five, acute renal failure.
What about right-sided heart failure?
As I stated before, the most common cause of right-sided heart failure is left-sided heart failure. In right-sided heart failure, there are signs. These include, number one, jugular vein distension. Number two, facial edema. Number 3, hepatojugular reflux. Number 4, hepatic congestion. Number 5, bilateral leg edema. And number 6, paroxysmal nocturnal dyspnea.
What about systolic heart failure?
Systolic heart failure is similar to left-sided heart failure.
What about diastolic heart failure?
While systolic heart failure is a problem with the contraction of the myocardium, diastolic heart failure is a problem with the relaxation of the myocardium. This results in a stiff myocardium, and diastolic volume will be decreased, but contractility is preserved.
What about high output and low output heart failure?
Low output heart failure is usually the result of acute myocardial infarction. Symptoms are similar to left-sided and systolic heart failure. High output heart failure is a demand problem. Cardiac output is within the normal range, but it is still not enough to meet the metabolic needs of the body. Some conditions that are associated with this are anemia, thyrotoxicosis, Paget's disease, beriberi, which is thiamine deficiency, hyperthyroidism, AV fistula, and pregnancy.
What about the physical examination?
In the emergency department, we may not be able to distinguish between left-sided and systolic heart failure. However, one of the findings with right-sided heart failure is that the lungs will be dry. Right-sided heart failure has signs such as dry lungs, JVD, hepatojugular reflux, or lower leg edema. On the other hand, left-sided heart failure have symptoms. There will be congested lungs, rolls or crackles. The patient will demonstrate shortness of breath, low blood pressure with tachycardia, and there may also be associated right-sided signs. Here are two chest radiographs depicting congestive heart failure. Notice the dilated heart and the increased vascular markings in the lungs. Now, curly B lines are normally associated with CHF or congestive heart failure, and curly B lines are short horizontal lines perpendicular to the pleura.
I have two more questions before you talk about the workup and the treatment. So, what is compensated heart failure?
Compensated heart failure occurs early in the stage of heart failure. It is the period in which the heart seems to have that extra push structurally and functionally in order to allow the patient to cope with a failing heart.
What is decompensated heart failure?
Decompensated heart failure occurs in the latter stage of heart failure. It is the period in which the structural and functional changes are no longer able to make the patient tolerate a failing heart. Let me go ahead and classify heart failure according to the New York Heart Association. Class 1. In this, there is no evidence of cardiovascular disease, and there are no symptoms or limitation with ordinary physical activities. Class 2. In this, the patient is comfortable at rest. However, light physical activities induce symptoms of heart failure. Class 3. In this, there is objective evidence of moderately severe heart failure. The patient is comfortable only at rest, and even less than light activities result in symptoms and limitation of function. And in class 4, in this there is symptoms of heart failure even at rest, and the patient is in constant discomfort.
So how do you work up a patient with heart failure?
The following should be included: an EKG, complete labs including CMP, complete metabolic profile, a CBC, PT, PTT, BNP, and UA. Cardiac enzyme should also be included, and an echocardiogram should be performed in the ER if possible, any at all, and of course a chest x-ray.
Finally, Professor, how do you treat heart failure?
Well, the first line medication therapy would include diuretics, ACE inhibitor, and beta blocker. If at all possible, these 3 medications should be given altogether. However, in an emergent situation, in the emergency room, the diuretics for sure should be administered, and nitrate can also be given in an emergent situation to decrease the preload. Other things that should be included in the treatment are salt restriction, weight reduction, exercise as tolerated, and compliance with medication with PCP follow-up as regularly as possible. Well, I do hope that this short presentation jogged your mind in allowing you to see a comprehensive picture of heart failure, and you will continue your studies diligently. Thanks for watching. Don't forget to like, share, and subscribe. I wish you well. Good night.